Salam. Peace be upon those who follow the light. Consider for a moment the elegant primal intelligence of the larynx, a guardian at the gate, vested with the sole sacred duty of separating the world that we breathe from the world that we consume. Laryngospasm represents the most dramatic failure of the delicate equilibrium that we maintain under anesthesia. It is the larynx, that vigilant guardian of the airway, executing its primary protective reflex with such fury that it threatens the very system that it is designed to protect and defend. So this is not a passive obstruction, but an active one. It's an active brainstem mediated event, a sustained tetanic spasm of the laryngeal musculature, sealing the glottis completely. The trigger is typically a nauseous stimuli like secretions, blood, or surgical pain applied during the light plane of anesthesia. So you have to be careful there. Where the higher cortical modulation of this primitive reflex is absent, our response must be as disciplined as the reflex itself. Following a strict physiological hierarchy, we first must stop the stimulus and attempt to break the spasm with positive pressure and jaw thrust. If this fails and hypoxemia progresses, then we must escalate to chemical dismantling of the reflex, and that will be a small dose of succinylcholine. Some people also use propofol, so you can use that. And we use it not to cause profound paralysis, but we use it because it has a very rapid onset, and we use it to create a brief depolarization block at neuromuscular junction, interrupting the efferent arc of the spasm and allowing the ventilation to resume. However, managing the acute event is only half of the battle. Our vigilance must then turn to the consequences, monitoring for negative pressure pulmonary edema in the aftermath, and formulating a plan for a secure emergence from that situation, knowing the larynx, once provoked, remains primed to react. So this is the essence of airway management: anticipating, responding to, and recovering from the body's own most powerful defenses. See you next time.